Hey everybody, this is Lane. This is my week 3 skills blog. For the questionnaire, I found out that I am moderate in my administrative skills, very high in my interpersonal skills, and moderate in my conceptual skills. At my hospital, Wake Med, where I work on 5A, we utilize a team nursing model of care. Together, we optimize patient goals by planning our patient's care together and deciding the best routes to take when trying to tackle complex tasks. We participate in activities such as huddles, where we collaborate together on what needs to get done, and we also do cyber rounds, where we include the primary nurse, the charge nurse, the manager, case manager, pharmacists, and doctors in the early morning patient rounds. This way, all issues for that patient are addressed, while everyone involved in the patient's care can be present. I think it's a very effective way of managing a patient's care rather than having everybody run around trying to get in contact with each other to collaborate on the patient's care. This way, everything is just done right then and there in the morning, and it's actually been working out pretty awesome for my floor. If I were to become a nurse leader on my floor, the skills I think I would use to secure resources such as staff would be my ability to immediately address problems as they arise and not try to avoid them. I think that's a problem with a lot of nurse managers, that they just kind of like skirt around the bush. They don't try to actually be effective and just address the problem as it presents itself. I also think my ability to be flexible and change would be a good thing to bring to the table as a nurse leader. As new nursing research surfaces, the field of nursing is constantly changing, obviously. In order to incorporate new research, we have to not be resistant to the change. I feel lots of nurses are resistant to change and therefore need an effective leader to help guide them through the process. And I'm pretty happy whenever we have some new research pop up in nursing. I get really excited about, incorporating that on the floor and seeing what we can do to optimize patient outcomes and, cut down on collapses and stuff like that. An article that I found on the school library was about transdisciplinary nursing care. It was called Transdisciplinary Health Education Training Team Players. This article focused on the importance of all members of the healthcare team collaborating effectively together, which is something I think is imperative to the healthcare field. You see, my hospital has both a horizontal and vertical structure. While we frequently collaborate with multiple disciplines such as nursing, radiology, lab, environmental services, waste industries, the ED, all the doctors, and all the different nursing units, we all have one goal in mind, which is keeping the patient safe. My article focused greatly on the importance of everyone being able to effectively collaborate together and work in a cohesive environment with good patient outcomes and safety at heart. As was stated in the article by Dr. Q. Ree, a healthcare team is like a sports team, except for instead of points, we are dealing with people's lives. Now, I couldn't have said that better myself. We have to be able to effectively work together in order to take care of these patients. We can't, have little squabbles or anything between departments. Although my hospital has a horizontal structure, we are also quite vertical. We have a chain of command that we go through. We have staff nurses, charge nurses, supervisors, managers, clinical administrators, CEOs. We have a whole chain of command people can go through. And I think that this is very important to nursing because we need to have established rules so everyone can know what chain of command they can go through. That way we can seek help, and if we don't get help there, we can move on to the next area in the structure. I think that's actually very important to having an organization. If we were to have a laissez-faire environment, not a whole lot of structure, I don't think a whole lot would get done. I think it's really important to have people that are in charge so that we can know who to go to in our time of need. But anyways, that's my skills blog for the week. Got to go to work now, so see you guys later. Bye.